A 45-year-old male presents with sudden onset severe chest pain radiating to the back. On examination, blood pressure is 180/100ths of a millimeter of mercury in the right arm and 140/90ths of a millimeter of mercury in the left arm. Aortic dissection is suspected. Which diagnostic test is most appropriate for confirming the diagnosis? A. Computed tomography angiography, CTA. B. Transthoracic echocardiography. C. Magnetic resonance imaging, MRI. D. Chest X-ray. A 30-year-old female presents with fatigue, irregular menstrual cycles, and excessive hair growth. Physical examination reveals hirsutism, acne, and central obesity. Which of the following is the most likely diagnosis? A. Polycystic ovary syndrome, PCOS. B. Cushing's syndrome. C. Hyperthyroidism. D. Ovarian tumor. A 65-year-old female presents with progressive memory loss and difficulty with language. On examination, she has word-finding difficulties and impaired comprehension. Her mini mental state examination, MMSE, score is 20/30. Which of the following is the most likely diagnosis? A. Alzheimer's disease. B. Vascular dementia. C. Frontotemporal dementia. D. Lewy body dementia. A 55-year-old male presents with sudden onset right-sided facial droop and weakness of the right upper and lower extremities. He reports a recent upper respiratory tract infection. On examination, there is no sensory deficit. Which of the following is the most likely diagnosis? A. Bell's palsy. B. Stroke. C. Multiple sclerosis. D. Guillain-Barré copyright syndrome. A 28-year-old female presents with joint pain and swelling, along with stiffness in the morning that improves with activity. On examination, she has tenderness and swelling of multiple joints, including the proximal interphalangeal, PIP, joints and wrists. Which of the following is the most likely diagnosis? A. Rheumatoid arthritis. B. Osteoarthritis. C. Gout. D. Systemic lupus erythematosus, SLE. A 50-year-old male smoker presents with chronic cough, sputum production, and dyspnea. Spirometry shows a reduced ratio of forced expiratory volume in 1 second, FEV1, to forced vital capacity, FVC, and a decreased FEV1. Which of the following is the most likely diagnosis? A. Chronic obstructive pulmonary disease, COPD. B. Asthma. C. Bronchiectasis. D. Pulmonary fibrosis. A 60-year-old male presents with painless, gross hematuria. Urine dipstick reveals the presence of blood, but no protein or leukocytes. Which of the following is the most likely diagnosis? A. Bladder cancer. B. Urinary tract infection. C. Kidney stone. D. Benign prostatic hyperplasia, BPH. A 40-year-old female presents with recurrent episodes of abdominal pain, diarrhea, and weight loss. Colonoscopy reveals multiple ulcers and skip lesions throughout the colon. Which of the following is the most likely diagnosis? A. Crohn's disease. B. Ulcerative colitis. C. Diverticulitis. D. Irritable bowel syndrome, IBS. A 25-year-old sexually active female presents with lower abdominal pain, fever, and abnormal vaginal discharge. On examination, there is cervical motion tenderness and bilateral adnexal tenderness. Which of the following is the most likely diagnosis? A. Pelvic inflammatory disease, PID. B. Ovarian cyst rupture. C. Ectopic pregnancy. D. Endometriosis. A 55-year-old male with a history of alcohol abuse presents with abdominal pain, jaundice, and weight loss. Laboratory tests show elevated liver enzymes and direct hyperbilirubinemia. Imaging reveals a mass in the head of the pancreas. Which of the following is the most likely diagnosis? A. Pancreatic adenocarcinoma. B. Acute pancreatitis. C. Chronic pancreatitis. D. Pancreatic pseudocyst. Answer 1. A. Computed tomography angiography, CTA. Answer 2. A. Polycystic ovary syndrome, PCOS. Answer 3. A. Alzheimer's disease. Answer 4. B. Stroke. Answer 5. A. Rheumatoid arthritis. Answer 6. A. Chronic obstructive pulmonary disease, COPD. Answer 7. A. Bladder cancer. Answer 8. A. Crohn's disease. Answer 9. A. Pelvic inflammatory disease, PID. Answer 10. A. pancreatic adenocarcinoma.